Okay, Professor Opladen, in your opinion, what's the best scenario for putting AADC in the umbrella of the neurotransmitter diseases, which are the main symptoms, diagnostic possibilities, and the importance of the early detection?
What I can say is that AADC deficiency is in the overall scope of rare diseases. So this means that we have difficulties for not so much specialized and experienced centers to find these patients, to identify them early as possible, and to bring them to appropriate treatment. I explain a bit why. If it comes to rare diseases, it is possible that we are talking about like 100, 200, or maybe sometimes only 500 patients worldwide. So if you calculate this probably on the population of Serbia or other countries in Europe, you will see that these countries have like 4 to 5. And in the end, this is difficult because you, as a clinician, as a treating physician, you don't have the experience. So I think here it's important that from the specialized networks, and I think one of the networks we're having is the so-called iNTD network. This is the International Working Group on Neurotransmitter-Related Disorders, to promote what kind of symptoms are speaking for a neurotransmitter disorder or even for the mentioned AADC deficiency. And why is this an issue? Neurotransmitter disorders have different clinical symptoms. Not all of them are comparable. However, they resemble somehow other neuropediatric disorders. So if I'm a caring physician somewhere in a child neurology department, I see many, many children, and the clinical symptoms are not always pointing clearly to a neurotransmitter deficiency. So I need to pick out those which distinguish neurotransmitter disorders like AADC deficiency from, let's say, cerebral palsy. And for this, in the iNTD network, we published guidelines, so clinical guidelines which are available online and open access. And in these guidelines, we define what are different or distinguishing clinical symptoms. And one example for AADC deficiency, for example, are the so-called oculogeric crises. This means that the eyes go up like a spasm of the eyeballs, and they tend to go up for like seconds or even days. And most of the times this is combined with overall clinical symptoms. So there's somehow the child is not feeling well, put it like this. And I think this is, as soon as you see this as a child neurologist in your department, you should think about some neurotransmitter disorder, specifically AADC deficiency. And then coming to the second point of your question, what can be used as diagnostic tool? And here again we have difficulties because most of the established labs in the world, they do not really measure those analytes which we consider to have, or where we say that this is needed. This is the first point. Or if you want to send and evaluate these samples in a foreign lab, this is timely, cost, and effortful. So here we have limitations. It is a bit better today since the genetic testing has improved. Many countries going on genetics first, and with this we have clearly improved the time or the delay to the diagnosis. And this has been published in a very recent publication in Nature Communications. So I think there is a development, and this is nice to see because this is also related and connected, I think, first to the improved possibilities, diagnostic possibilities, but also to the raised awareness. And there's another new diagnostic tool which I think is very promising, specifically for AADC deficiency, and this is an easy screening of a certain metabolite from a so-called dried blood spot. Most of the parents, they know this because this is the blood spot which you take right after birth from your child, from the newborn child. And I'm a bit proud to say that there was a method developed in our university hospital in Heidelberg where we can measure this dry blood spot and find a metabolite which is very specific for AADC deficiency. So you have a test which is sensitive, which is easy, which is not expensive, and so here you have, with the measurement of the metabolite, it's 3-OMD, 3-O-methyl-dopa, and a way to find the diagnosis quite early. And I think this is important to promote, that we have today newer diagnostic opportunities to find this. What are the next things? I think we know from rare diseases, and most of them are genetic and in the following metabolic, that early treatment is important. So the awareness on the clinical symptoms, on the diagnostic tools, will have a clear effect on the outcome, the neurological outcome of the patients. So I can only raise this awareness, telling look for AADC deficiency. We have different therapeutic options. Also here we have published guidelines, clinical guidelines, which have been done in the context of iNTD, of the iNTD network, and this is open access available. So this is in a nutshell what I think about AADC deficiency and the group of neurotransmitter disorders.
I think you answered all my questions, and thank you for your time.